From learning loss to mental health, our KSHB 41i team has been looking for answers to help families navigate a variety of issues. Anchor Caitlin Canute took some of your questions to local experts as part of our series, COVID Crisis in Kids.
When it comes to mental health and kids and teens, what are you seeing? Are you seeing increases in anxiety, depression, suicide attempts, etc.? What are you seeing?
Across the board, we're seeing an increase of overall anxiety. I think there is a level of depression that's increased.
We're noticing that any kid that had any type of anxiety around school, now trying to come back and reintegrate into face-to-face when they've been home for so long, really just magnifies all of those anxieties that they had.
And our data shows that there has been certainly an uptick, 160% increase from last year in the number of suicide assessments that we have completed this year, 354 assessments.
When you're talking about doing these suicide assessments, these are at-risk students who are going through something, certainly. Are you seeing this more with older students, or do you have to do these even with some of your younger students?
Our suicide assessments are obviously any of our behavioral social workers can assess a student early childhood through 12th grade. We see them at all levels, including elementary school. And I think obviously that isolation exacerbated that, just really exposed the need that we have.
As a parent, what can we do as parents, Tim? What can we do for our kids if we notice that they seem anxious or we notice that they seem lonely and we don't know how to reach them? What do you recommend?
So the first thing that I think is important is to basically listen, to ask questions, to seek to understand how they're feeling, to validate those feelings and to make sure that they know that those are normal feelings. But that also to keep an eye on it and routinely check in with your youngster about how they're doing, because then you'll be able to determine whether this is a normal part of coping or if they need some professional intervention.
What's the baseline for your own son or daughter? And to make sure you're listening and affirming and validating. And most importantly, don't dismiss it, because you can't see it and because it doesn't always look like a young person that may be physically depressed or physically withdrawn. We have students that are experiencing depression that look like they're thriving.
If parents recognize there's a need, if parents are looking to get their child some help and can't find an available therapist, is there anything that you at the school district level can do to help?
Sure. We always recommend to our parents that they reach out to us and partner with us because we have some of those community relationships that we can leverage. The most dangerous thing you can do is think, this won't be my child. This won't be my kid that's struggling.